In today's liberated society, where sex is freely given and embraced, a troubling issue lurks beneath the surface. Unprotected sex is on the rise, yet comprehensive sexual education is sorely lacking. This dangerous combination is fueling a surge in STIs or sexually transmitted infections, highlighting the urgent need for better education and awareness to protect public health and ensure safer sexual practices. Every day, over 1 million people globally acquire sexually transmitted infections, with most cases showing no symptoms. Annually, this amounts to an estimated 374 million new infections, underscoring a critical public health challenge. The asymptomatic nature of many STIs complicates detection and treatment, emphasizing the need for widespread education, regular testing, and accessible healthcare. So what really is STD? Sexually transmitted disease, or STD, is a serious condition caused by sexually transmitted infections, or STIs, such as bacteria, viruses, or parasites. These infections can affect multiple body systems and, if untreated, can lead to serious health complications. STDs represent a significant public health issue worldwide, requiring effective diagnosis, treatment, and management strategies to mitigate their impact. 8 pathogens are responsible for the highest incidence of STIs. Of this, 4 are currently curable: syphilis, gonorrhea, chlamydia, and trichomoniasis. The remaining 4, hepatitis B, herpes simplex virus or HSV, human immunodeficiency virus or HIV, and human papillomavirus or HPV, are viral infections without cure. Chlamydia. Chlamydia is a common bacterial STI caused by the bacterium Chlamydia trachomatis. It can infect both men and women and is often asymptomatic, meaning many people may not realize they have it. However, if left untreated, it can lead to serious complications such as pelvic inflammatory disease or PID in women, which can cause infertility, and epididymitis in men, which can lead to infertility as well. Chlamydia can be easily treated with antibiotics. Gonorrhea is caused by the bacterium Neisseria gonorrhoeae and can infect the genital tract, mouth, or rectum. Like chlamydia, it often doesn't cause symptoms, especially in women. If symptoms do occur, they may include painful urination and abnormal discharge. If left untreated, gonorrhea can lead to serious complications such as pelvic inflammatory disease, infertility, and in rare cases, can spread to other parts of the body, causing joint pain and even heart valve damage. Gonorrhea can also be treated with antibiotics. Syphilis. Syphilis is a bacterial infection caused by the bacterium Treponema pallidum. It progresses in stages and can have serious long-term consequences if not treated. But it can also be treated with antibiotics, especially in the early stages. The primary stage is characterized by a painless sore or chancre at the site of infection. If untreated, syphilis progresses to the secondary stage, marked by a rash and flu-like symptoms. The disease can then enter a latent stage where there are no symptoms but the infection remains in the body. Late-stage syphilis can cause severe damage to the heart, brain, and other organs, potentially leading to death. Trichomoniasis. Trichomoniasis is caused by a parasite called Trichomonas vaginalis. It is one of the most common curable STIs and primarily affects the genital tract in both men and women. It's treated with prescription antibiotics, wherein symptoms can include itching, burning, and unusual discharge. In women, it can also cause discomfort during intercourse and urination. Trichomoniasis can increase the risk of contracting other STIs, including HIV. Hepatitis B. Hepatitis B is a viral infection that attacks the liver and can cause both acute and chronic disease. It is transmitted through contact with affected blood or bodily fluids, such as during unprotected sex, sharing needles, or from mother to child during childbirth. Symptoms of acute hepatitis B can include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, clay-colored bowel movements, joint pain, and jaundice or yellowing of the skin and eyes. Meanwhile, chronic hepatitis B can lead to serious liver problems such as cirrhosis or liver cancer. Hepatitis B can be prevented with a vaccine, and there are antiviral medications available to treat chronic hepatitis B. Herpes simplex virus or HSV. HSV is a common viral infection that manifests in two main types, HSV1 and HSV2. HSV1 is often associated with oral herpes, causing cold sores or fever blisters around the mouth, while HSV2 is typically associated with genital herpes. However, both types can cause oral or genital infections, wherein symptoms can include painful blisters or sores, itching, and flu-like symptoms during the initial outbreak. After the initial infection, the virus remains dormant in the body and can reactivate periodically, causing recurrent outbreaks. While there is no cure for HSV, antiviral medications can help manage symptoms and reduce the frequency of outbreaks. Human papillomavirus or HPV. HPV is a group of viruses that infect the skin and mucous membranes. There are over 100 types of HPV, some of which can cause genital warts and others that can lead to various cancers, including cervical, anal, penile, vaginal, and oropharyngeal cancers. HPV is transmitted through sexual contact, and most sexually active individuals will contract HPV at some point in their lives. Many people with HPV do not develop symptoms and clear the infection on their own, but others may experience genital warts or develop cancer years after exposure. Furthermore, vaccines are available to protect against the most common cancer-causing strains of HPV, and regular screenings such as pap tests for cervical cancer can help detect HPV-related abnormalities early. Human immunodeficiency virus or HIV. HIV is a virus that attacks the immune system, specifically targeting CD4 cells, a type of white blood cell, and weakening the body's ability to fight off infections and diseases. HIV is primarily transmitted through unprotected sexual intercourse, sharing needles or syringes with someone who has HIV, or from mother to child during childbirth or breastfeeding. Symptoms of HIV infection may not appear for many years, but as the disease progresses, it can lead to acquired immunodeficiency syndrome or AIDS, a condition characterized by severe immune deficiency and increased susceptibility to opportunistic infections and cancer. There is currently no cure for HIV, but antiretroviral therapy or ART can effectively control the virus, allowing people with HIV to live long and healthy lives. Prevention measures include practicing safe sex, using clean needles, and accessing pre-exposure prophylaxis or PrEP for individuals at high risk of HIV infection. No one is safe from getting STDs. However, there are numerous tools, strategies, and ways developed by medical practitioners for their prevention. First and foremost, get tested. Knowing your status is the first step to preventing STDs. Whatever the result, positive or negative, follow the following steps to prevent or treat the latter. Number 2. Vaccination. Vaccines are available for certain STDs such as hepatitis B and human papillomavirus or HPV. Vaccination can prevent infection with these viruses and reduce the risk of related complications, including liver cancer and cervical cancer. Third, education and awareness. Providing comprehensive sex education that includes information about STDs, safer sex practices, and the importance of regular testing and treatment. Fourth is safe sex practices. Condom use. Using condoms reduces STD transmission risk. Limiting partners. Fewer partners and tested partners lower exposure risk. And lastly, communication. Open talks on sexual history and prevention promote safer sex. Fifth, pre-exposure prophylaxis or PrEP. For individuals at high risk of HIV infection, PrEP medication can be prescribed to reduce the risk of acquiring HIV. And lastly, do not inject drugs. However, if you do, always use medically issued sterile needles and equipment to avoid transmission of infections. Other STDs can also be cured or treated. Here are the following treatments. First is antibiotics. Many bacterial STDs such as chlamydia, gonorrhea, and syphilis can be treated with antibiotics. It's essential to complete the full course of medication as prescribed by a healthcare provider to ensure the infection is fully cleared. Second is antiviral medications. Viral STDs such as HSV and HIV can be managed with antiviral medications. While these medications may not cure the infection, They can help reduce symptoms, suppress viral replication, and prevent transmission to others. Third is topical treatments. Some STDs like genital warts caused by HPV can be treated with topical medications or procedures such as cryotherapy or freezing or laser therapy. Fourth is supportive care. Symptomatic relief such as pain management and topical treatments for discomfort may be recommended for individuals experiencing symptoms related to STDs. Fifth is partner notification and treatment. Encouraging individuals diagnosed with an STD to inform their sexual partners so they can seek testing and treatment if necessary, thereby preventing further transmission. And lastly, follow-up testing. Follow-up testing after treatment is important to ensure the infection has been successfully cleared and to detect any potential reinfection or complications. With all of that said, always remember that prevention is better than cure. So let us be aware and be educated.